Hi, I'm Dr. Brian Koffman, the co-founder, Executive Vice President, and Chief Medical Officer of the CLL Society. And I'm here to bring you some breaking news about the update to the fact sheet for healthcare providers' emergency use authorization of the Evusheld. This is really similar to the package insert, and it was changed today, October the 3rd, 2022. The update changes the guidance offered to healthcare providers concerning Evusheld, the mix or cocktail of two monoclonal antibodies, tixagevimab and cilgavimab. This is the only authorized pre-exposure prophylaxis against COVID-19 for the immunocompromised, whose protection from vaccines is unpredictable and less robust. Evusheld is a way to protect people who do not respond to the vaccines by giving them the antibodies pre-made. The CLL Society wants to quickly explain these changes to you, and will share more information as we learn more from our meetings with the FDA, the CDC, ASPR, and AstraZeneca, the manufacturers. Let's start with the bottom line. CLL Society still recommends everyone with CLL or SLL, chronic lymphocytic leukemia, or small lymphocytic lymphoma, consult with their healthcare providers and inquire about accessing Evusheld, as it remains helpful for the dominant strain circulating today, October the 3rd, 2022. However, for the very first time, the FDA has stated, and I quote from section 5.3 of the fact sheet, certain SARS-CoV-2 viral variants may not be neutralized by the monoclonal antibodies such as tixagevimab and cilgavimab, the components of Evusheld. Evusheld may not be effective at preventing COVID-19 that is caused by these SARS-CoV-2 viral variants. Also, higher levels may be needed to neutralize certain variants that still can be achieved with the dosing as it is now. We also echo the FDA's strong message, and I quote again, if signs or symptoms of COVID-19 occur, test for COVID-19 and seek medical attention, including starting treatment for COVID-19 as appropriate. And we would emphasize this needs to be done quickly, as most treatments work best when given in the first few days. Looking at the data that was provided by the FDA, the most resistant variant appears to be BA.4.6. They tested using a pseudovirus and not the more robust authentic viral testing. Still, while this needs to be confirmed, and BA.4.6 represents only 12.8% of what is circulating right now, its proportion is growing. This is an obvious concern that we will be watching closely. So what does this mean for those of us with CLL or SLL? Our advice remains the same as always. Number one, get vaccinated and get boosted with the new bivalent vaccine. Some good news here. Both bivalent vaccines appear to be still providing similarly reassuring levels of protection against all the new variants, at least to those who respond to the vaccine. Get Evusheld. It still protects, albeit needing higher levels, against BA.5 that represents about 80% of the COVID that's circulating today. 3, maybe it's time to be even more careful about wearing a well-fitting N95 or KN95 mask. Practice good hand hygiene and avoid high-risk environments such as crowded or poorly ventilated indoor spaces. And 4, and finally, continue to be careful. The pandemic is not over for those of us with CLL, SLL, but we can still be part of the world with appropriate precautions. Keep checking back, as this is a developing story, and we'll be sharing more updates as they occur. Stay strong. We are all in this together. Dr. Brian Koffman.